So Chapter 46 is all about the upper GI system and the problems that can occur in this system. Be very aware when you're looking through it that there should be 4 sections that you read through. There's no need to read through all the chapters. So the 4 sections are nausea and vomiting, GERD, PUD, and upper GI bleed. So when you're looking at the sections, I really want to give you key points to focus on. For nausea and vomiting, briefly review the pathophysiology, specifically know the purpose of CTZ, as it is important to consider with medications, as many medications block CTZ, and that's the receptor that allows the medication to work. So briefly review all that. Review Table 46.1, the drug therapy, really noting the side effects. When you're reading through that, be thinking, as a nurse, if I'm giving this medication, what should I be aware of? And look through that, as there will be a few test questions that cover nausea and vomiting medications. How will you assess the patient? What questions will you ask? Will you ask what was something they recently ate? Will you ask how long have they been having nausea and vomiting? Do you think, hey, are you a young female that may possibly be pregnant? Those kind of questions that are important to look at. And then how will you treat the patient? This is very important because you don't want to just say, okay, you came in through the ED, you have nausea, let's give you some medicine. You want to find the cause and treat. There should be no blind treatments. This can be kind of difficult at times because your patient may be miserable with the nausea and vomiting, but you don't want to cover that up. And then a lot of treatment is due to dehydration. When people are nauseous and vomiting, they don't want to hydrate very well, so be thinking treating dehydration. GERD. GERD is very popular in a lot of different patients, but it is not something that is usually diagnosed immediately. It's diagnosed over time. Review the pathophysiology, especially reviewing the factors affecting. Considering from the beginning, what would you educate your patient of? This is going to be on a lot of nursing tests. You need to take what you read and think, how am I going to educate patients for reviewing? So for example, if they say, man, every time I drink coffee, man, I get this really bad acid reflux, which a lot of times is GERD, what are you going to say? Hey, let's think of other options besides coffee for you. What can you educate them to? Think clinical manifestations. This can cause long-term damage if not treated, especially to the lungs. The other thing to be aware of is a lot of people will come in and then we're like, man, my chest really hurts, it burns. Is it heartburn or is angina a sign of a heart attack? So we really can't say, oh, this is probably your acid reflux, just take some medicine. No, we need to work them up and say, is this acid reflux or is this chest pain, heart attack? So really looking at the in-between of those two. Be thinking, how are you going to diagnose this? Look at that section. And management, table 4690, very important to consider patient education again. And then drug therapy, know your PPIs and H2 receptor blockers, as those are the most effective. And I can tell you that this is something that is given a lot in hospitals. So be thinking PPIs and H2 receptor blockers, as that is also something that's going to be useful in a lot of your other diseases that you will look at. Peptic ulcer disease. Know the different types of ulcers. You have acute, you have chronic, you have gastric, and duodenal. Look at the different factors of what, when a patient eats and they don't have any kind of distress until 2 hours after they eat, which kind of ulcer is that going to be? The major risk factor is H. pylori. How can you detect it? What is the most useful way to detect H. pylori? And then think, maybe they don't have H. pylori. What most likely is causing those peptic ulcers? We see a lot of NSAIDs, whether it is a young person who works out a lot that takes a lot of NSAIDs, or a patient who recently had a twist in their elbow and now it's hurting really bad, so they're going to take a lot of NSAIDs to help with that pain. Now they've developed an ulcer. Think lifestyle factors as well when you're looking through that section. How are you going to diagnose? You're going to go and scope them with biopsy. When you biopsy, you can find that H. pylori. So when you're looking at this, know your labs, know what you're going to look for. Management, usually we give amoxicillin for the H. pylori, And similar to GERD, a lot of the same medications, so that's something to be aware of is know your PPI and your H2 receptor blockers. Complications, GI bleed, perforation, gastric outlet obstruction. Really look at those three. Look at how they're going to present, whether they're going to have a rigid hard belly, whether they're going to have a fever. Look at how those present so that if, say, a test question comes up that says, hey, your patient presents with blank, 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 you can say, man, this sounds like a complication of PUD and it's perforation. Again, patient education, extremely important to consider when you're reading. How will I educate my patient with peptic ulcer disease to prevent this? Those kind of ideas, so very important to look at. And finally, upper GI bleed. Know the different types of bleeds. There's quite a few, but just kind of review those. Look at your diagnostic studies, both your endoscopy and your lab studies. Look at your physical assessment. When you're thinking physical assessment, think ABCs first: airway, breathing, circulation, okay? Those are the ones you are going to immediately look for and assess, and if there's an issue, you need to fix that first. So let's say you got upper GI bleed patient, and all of a sudden their blood pressure's low. You're not going to stop and be like, oh man, let me go, treat the nausea or anything. You really need to go and treat the blood pressure. Look for different complications of things that can happen. Drug therapy, again, your PPIs are extremely important here. Your nurse importance, think intake and output, right? You really want to know how much your patient is bleeding. So really look at, you don't want to just say, oh man, they had 3 bloody emesis, which is vomiting. You're going to look and be like, man, they had 200 mils of bloody emesis. Because I feel like 50 mils of bloody emesis versus 1,000 mils of bloody emesis is really going to be a difference. And then educate your patient to prevent future bleeds. How can they prevent this from happening again? Because a lot of upper GI bleeds are repeat offenders. So how are you going to educate these patients before they leave the hospital of how to prevent this?